This is a report that's basically focused on the burden of non-communicable disease and injuries among the world's poorest billion people. So these are people that are living in what's sometimes called as extreme poverty. And we worked on this report because we thought that this aspect of what was at stake for the world's poorest people, namely their non-infectious diseases, wasn't sufficiently understood. And there was really no current global framework to adequately address their needs.
Non-communicable diseases of the poorest billion are not well known, are neglected diseases. Some of them, we can even say the majority of them. The so-called tropical diseases that are not very well described, which then leads to lack of knowledge on how to treat them and how to control them. Even in the cases where we know and we have evidence-based strategies to treat these diseases, sometimes because they affect the poorest billion, they are not tackled even if they are preventable. Unfortunately, financial support for non-communicable diseases in the poorest billion is very low, and more than that, it's steady and it's not growing over time. So this is another area where we wanted to call the attention of the world, the health community, and the donors and big organizations dealing with health. Our goal was really to target equity, because we think that these were people who were being left behind. And second, we thought that the world, although trying, was not achieving the goal of being just, and for justice to be made to these poor populations, we could not only have an agenda that is targeting infectious diseases, but also an agenda that will target non-communicable diseases that mainly affect this part of the population. So, although most of these countries that have the poorest billion people are low-income and low-middle-income countries, there are also neglected populations in richer countries, in developed countries. And this report is really about all of them. The report brings new ideas, new proposals on how to best tackle this big variety of diseases that we talk about. And specifically, we think that if we integrate care, if we start building interdisciplinary teams for care provision, for health promotion, for preventive medicine, other sectors to the table with the health sector, we may close the gap that we have currently in terms of the means and the tools that are available for these countries, so that we can improve the quality of care globally by strengthening the health system in such a way that we can also cover non-communicable diseases of the poorest billion.
One huge opportunity that we have with this report is that it wasn't just a report, it was really a process of movement building. So we worked very closely with 16 national NCDI Poverty Commissions, which is really unique for this kind of work, not just on priority setting, situation analysis, but actually in many cases getting to the point of actual service delivery. And really, that was something that was extraordinary about these national commissions. Historically, we've had these global priorities, that we call the best buys, but they weren't really based on any kind of process of deliberation at the country level. They didn't really take into account equity, which is really a key concern in priority setting that we know is very important in terms of priority to the worst off. And these commissions are an example of what happens when you look at local data, you have local groups that are assessing their priorities, and then that are working together to actually implement them and support countries to implement them. So we really have an amazing foundation here for the next decade to make a real difference for the people affected by these conditions.
This commission started working at the verge of COVID-19 and have been able to innovate in terms of care to people with chronic diseases. by starting small projects that were funded by the Commission. One of the major problems has been loss of continuity of care in patients with chronic diseases in our low-income settings, and also an increase in poverty because people are not able to keep their employment, people are not able to get assistance, and also because of the restrictions in mobility, etc., people cannot interact and keep the social network that usually exists that enables them to face some of these health challenges that people with chronic diseases face in developing countries and in the poorest billion in general.
In a way, what this report is pointing to are opportunities for new kinds of coalitions, new forms of global solidarity. The strength of the NCD movement is it's a kind of alliance among people that are affected by these diseases, right? It's a disease-based movement. And so this is pointing to opportunities for people around the world that are affected by these diseases and that share a common humanity. And how can they come together to have meaningful action?